Have you been told you need a dental implant and you also have osteoporosis and you're wondering, well, can I get this implant because I have osteoporosis? I'm Dr. Mitchel Miro and I'm an associate dentist here at Dental Implant and Aesthetic Specialists. And today we're going to talk about dental implants and osteoporosis. While it is known that osteoporosis can affect your bone quality, it's not necessarily a contraindication to getting dental implants. A lot of patients think, well, if I have osteoporosis, I can't get dental implants. That's not necessarily the case. Here at Dental Implant and Aesthetic Specialists, we really like to work with your primary doctor, your doctor that's treating your osteoporosis, and make sure that we come up with a plan that's best for you. That means we want to consult with them, make sure that you are a good candidate for this dental implant. That being said, most patients with osteoporosis are candidates for dental implants, and we usually have no problem with the recovery rate. Here at our office, we're a pros office at its core. Therefore, we see a lot of patients that need dental implants, but also a lot of patients that are above 60, and osteoporosis is one of their medical conditions. Therefore, we're readily equipped to handle this. One of the big deciding factor for patients with osteoporosis is what medication they're on and how long they've been on their medication. That's why we really need to work with your doctor that's been prescribing your medication for osteoporosis. This is the first thing that we really take into consideration when deciding, can we place an implant on a patient with osteoporosis? The biggest test that we really have to measure, can you get an implant and you have osteoporosis, is really your bone density. That's really what determines if you're a good candidate for an implant. That being said, a lot of patients who have been on bisphosphonate medications for osteoporosis for a really long time and feel disheartened because they can't get an implant, we have options for you too. Here at Dental Implant and Aesthetic Specialists, we work to serve our patients, and we have many options to replace missing teeth. Really, the biggest option that we give patients if they aren't a candidate for that implant because they have osteoporosis is a dental bridge. A bridge is something that adjoins the two teeth. It's fixed in your mouth. You can't take it out. No one will be able to tell that you were ever missing your tooth. And really, that's a great option for some patients who maybe have been on this osteoporosis medication for 5 to 10 years, and they're just not a candidate for implants. That being said, a lot of patients with osteoporosis, even though we do have other options, really what they want is that single implant to replace that missing tooth, and that's okay. We will work with your provider. Sometimes we have patients go on drug holidays. A drug holiday is maybe they stop taking that medication for a small amount of time. Usually their doctor will say, if they don't take it for 3 months, that's totally fine. Let the patient get the implant, let them heal, and then they're happy to start them back on the medication. We really do take a collaborative approach to all of this. We work with not only the patient, but with their doctors in order to assure that whatever is best for them is what we are doing in the end. Patients end up being extremely happy with whatever decision they make, whether it's the implant or the bridge, as long as they know that it's the best decision for them and for their overall health. Do you have osteoporosis and you have a missing tooth and you need an implant? Or maybe you're just wondering, what is the best option for me? We're happy to give you a consultation. We're happy to work with your doctors, and we're happy to get you back to that smile that you want and you need in order to function. I'm Dr. Mitchel Miro, and I'm a dentist here at Dental Implant and Aesthetic Specialists. I'm here to help you. Watch your mouth. In order to provide the patients with